Good morning, everyone. Final day of Fire DevDays 2024. Thank you, Gino. I know I can always count on you. I hope you all had a pleasant evening yesterday in the mill, that you enjoyed the view over there. And I'm glad you're all here at this early time of the day. And we will kick off the day with the DevDays Implementer Award. But before I do, I have a short announcement. Some of you may have seen that there's a police presence outside the building. This is because there's a Board of Regents meeting here in this building from the University of Minnesota. Protestants from the Gaza, protestants are not expected, but this is a precautionary measure, so just so you know. Okay, and with that, we'll kick it off with the DevDays Implementer Award. Why do we have an Implementer Award at all? Well, we want to celebrate the successful use of Fire. And what do we mean with use? It's real-world impact. So this is not about how cool your technology is and how proud we all are of what we've achieved in more than 10 years of Fire. This is about Fire being actually used. This has very much to do with the board that we set up in the back, the Gartner Hype Cycle, which is associated with the Amara's Law. I'm sure you all know this law. We tend to overestimate the effect of a technology in the short run and underestimate the effect in the long run. And this was originally defined for nanotechnology, but it applies to many technologies. Think Zoom during COVID, or currently what we're experiencing with AI, and I think it also applies to Fire. So Fire has been a promise for many, many years, but now it's time to shift to proof. And DevDays, as you all know, is about implementation. It's not so much about building the standard, it's about implementing the standard. And that's why we thought it would be a good idea to recognize real-life implementations of the Fire specification. So we issued a call to submit candidates for the award. This is the first time that we do this. And we have set out a few criteria. First of all, user impact. So user impact means how many users are actually using your system or app or whatever on a daily basis. What is the contribution to the organizational goals? What is the proven business value? What is the ROI? And not so much, can it ever have an ROI? No, we want to know what is the current ROI. And what is the actual contribution to better care? How many doctors are using this app, and does it improve their workflows? How many patients are using the app, etc. So it was not about potential benefits, because there's a lot of technology out there that could improve patient lives, but we want to see the real-life impact. It's not about the coolest technology or cutting-edge Fire. We did not take that into account. It's also not about how many APIs you have deployed. It's about how the APIs are being used. We were not interested in proof of concepts, not interested in pilots, etc. And we had to be strict because we had many applications that on paper looked extremely promising, and the technology and the architectures were really impressive, but we wanted to see even the simplest app, is it actually being used? And some of the applications did not have the evidence of actual use. So the funny thing is, although we are here in the United States, we picked two candidates who met the criteria of the award, both not from the United States. I'm not sure, maybe an award is not something that you do in the United States. But anyway, maybe it's also because it's still a new thing, the Fire Implementer Awards. It's the first time that we kick this off. So hopefully next year we'll have some applicants from the United States as well. And with this, I would like to hand it over to Dan to introduce our nominees.
Terrific. Well, it's really exciting to be here in this inaugural DevDays Implementer Award. I can predict, just sort of seeing the trajectory of the Nerd Award competition, that next year is going to also be pretty steep, so just keep that in mind. But today, we're pleased to share our first nominee for the DevDays Implementer Award, a project by Synapse. That will be presented by Victor Chai, if you're welcome to come up. This is a Healthier SG repository for the Singapore National Healthier SG program. Victor. Yeah. Oh. I can, yes. So here's how this is going to work. Your job is to help us select the winner. So in order to do so, there is a poll that is inside Whova. If you go to, everyone pull out their computer or smartphone and go to this particular session, because the poll lives inside this opening session. And once you get in there, you'll see the link to the poll, and this is going to be a live tabulated event. So yes, you probably do want to wait to hear both presentations, but in your mind, be ready to press that button when you've made your selection. And at the end, we'll tally up the results and present the winner. So be ready, Whova app inside the session. All right, with that, please welcome to the stage, Victor.
Okay, thanks. Good morning, Victor from Singapore. In fact, our company name called pronounced Synapse, not Synapse, yeah, Synapse, yeah. So today I'm going to share about 10 facts about our Health SG national program. 3 problems, and 3 amazing achievements, and 4 areas of business impact. Okay, this slide's here. Okay, so the 3 challenges facing is the Health SG national program to address the 3 key challenges. One is the aging population. Number 2 is the rising impact of the chronic conditions. Number 3 is the rising healthcare costs. So what's the 3 amazing achievements? So first amazing achievement is the pervasive use of HSM within the solution, from API, database persistence, and also the backend integration with analytics platform. And the second achievement, amazing achievement, is in terms of amazingly elegant solution design. So we're able to handle the ongoing change from like a health plan, questionnaire response, questionnaire, and composition without single line of codings. The third amazing achievement is, in fact, the amazingly fast for IT implementation. We only took 9 months from initial requirements, design, and file API design, implementation, and put into production run within 9 months. And the system has been going live since July 2023. Yeah. So lastly, I'll cover the 4 areas in terms of like the area of business impact. In terms of user impact, the solution has been used by the healthcare professionals for more than 40 public healthcare institutions, and also more than 1,005 private sector healthcare providers. Healthcare provider, which means the family doctors. Then we have also more than 2 million residents, like for me, like residents using the systems through our healthcare mobile app. And out of 2 million residents, there's more than 900,000 active users using the systems. This is from the resident perspective. Then how does the second area talk about in terms of organization goal? How does it contribute to organization goal? Through the Health SG implementation, the whole healthcare ecosystem within Singapore become proficient in HSM. So, and that's when we also become HSM also established as the key IT enabler for the health IT ecosystems. The third area in terms of business value. So initially, for example, I want to put a dollar amount, but I put a dollar amount because I need to clear our company leadership and the legal. So instead I put it like not the quantitative business impact, I just put a qualitative business values. So it has like the data is easily shared across different care providers. So that enable the holistic care across the whole ecosystems. The second one, of course, the second and third in the business value, reduce the IT cost from design, implementation, and ongoing enhancement, and also reduce the IT cost on training. Lastly, I will talk about how do we contribute in terms of care transformation. From resident perspective, each resident, just like you and me, for example, actively participate in the program through the readily accessible health plan information and the activities, so we can take control and stay healthy. From provider perspective, different care provider or different care team from different organizations able to participate and contribute the care plan for the patients. Yeah, so that's all I have. So 10 important facts, 3 challenges, 3 amazing achievements, and 4 areas of business impact. That's all. Please vote for us, Singapore National Health SG Program.
All right, that was wonderful. So you've got your first contestant. For those of you who may have come in late, we're going to be voting on these presentations. Queue up the poll that's in Huva in this particular session. Next up, we have our second nominee for this award, presented from the organization ARIA SPA, as presented by Relay Health. This project is titled A Fully Fire-Based Territory Digital Management System for the Lombardy region. That'll be presented by Paolo Testa, project manager. Come on up. Please welcome to the stage, Paolo.
Hello, good morning, everyone. I'm Paolo from Health3 Reply. Reply as a customer area SPA, and I'm about to introduce you the new digital management system of Lombardy region. So Lombardy region is the greatest region in Italy. It has, of course, not only for population, no, it has more than 10 millions of peoples. And a few years ago, the healthcare institution came to us and asked, can you help us to design and implement the new regional health management about 2 particular topics, home care and bed occupancy. It was 2021 after COVID pandemic, so also the bed occupancy to monitor how the hospital have occupied was very important. So we said yes, and for home care project, we thought that the home care was a very suitable use case to implement and use fire standard. Why? Actually, because we have several health actors, like nurses, therapists, that have to go to the house of the patient and do medical treatment. And then they have to record and track all this treatment on a mobile app, on the tablet or smartphone. So fire that is, let's say, web-based, we think that it was a very good idea to use this standard. The project went live in April 2023. And here are some of the numbers of the project in the production system. So the system integrates the Lombardy Healthcare Regional System, which is the system where primary care physician write the care plan of the patient, and then we integrate 94 healthcare providers. Healthcare providers that have different software houses, so we did not implement the client app where the nurse track the treatment, but we have scenarios and a set of different vendors that were involved. So in the last month, May 2024, the number of active users was more than 60,000, patients more than 100,000, and the number of API calls made per week, it's around 27,000. What I want to underline and share with you is some feedbacks about the use of implementation guides. because we thought that it was very useful not only for technical people as a developer, but also for functional analysts. So in this web app, we have all the workflows, the profile, value set, also the documentation for the supported RESTful API, all the examples that are needed to implement this project. So after 1 year, we can draw some conclusion, and we can say that we have helped the organization to reach its goals. We are collecting real-time data on home care delivery. We allow doctor to monitor the care plan progress of the patient. And we are also enabling the system to accounting and remuneration purposes. Moreover, we have given to the healthcare regional government dashboard in order to monitor the hospital bed occupancy of the hospitals. So we have positive feedbacks, both for implementer and especially from the final user that have seen this project born in 2021, and it was implemented and went to production in just a few years. And that's it. Okay. Thank you, too.
All right, so there you have it. It is now time to place your votes. Open up the Whova app. I hope you've listened intently. Let me jump back and see. I'll just show here for a second the criteria in case you're wondering how you should be thinking about these two. Focusing on these four criteria we have here: user impact, contribution to organizational goals, business value, and contribution to better care. So I'll give you a few more seconds to place your vote, and then we'll make the tally. We should have queued up some suspenseful music of some kind for this particular moment. I don't think we actually have any such music, but we can just pretend. Maybe we should. Yeah, exactly. We could reprise the lovely song from the other day. We won't do that yet. All right. The poll is, yes, the poll is in this session, so make sure you go to, I believe it's called, what is it called? Opening session. Let's see here. Plenary. Plenary session and announcement, winner, implementation award. First thing, just past breakfast in the full agenda for today. If you pop that open on your app, you'll see the little set of icons there on the top right will be polls, and you'll see the one poll in there. All right, I can't see the actual results, but I can see that people are completing. 112 votes are in. Keep them coming, keep them coming. You can't vote more than once. Yeah, maybe you can't, right. Unless you have the special power. All right. While we're waiting, I hope you all are thinking about potential applications for next year as well. Now that you know the criteria here, you can be planning ahead. Plan to make this a repeat event here at DevDays. And as incentive for your participation, not only do you get the amazing privilege of being here and the notoriety and so forth, but there is an actual physical prize as well as the benefit of a free admission to next DevDays for the offering. So please keep that in mind as well. All right, we're going to count down. We've got, let's see, we've got 15 seconds left here. 10. Are you ready? You ready? I see everybody fingers off, 5. Last push. All right, here we go. Dun, 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 dun. We're doing our math to add up all the numbers. This is secret. I don't know who this is going to be. I can't see it, so I'm waiting just like you all. All right. Thank you very kindly. And the winner is our colleagues from Singapore with a total of 67% of the votes. Victor, congratulations. Yes, please come up. That's terrific. Terrific. Okay, congratulations. All right, congratulations. Yes, and just to be clear, there is a free ticket to next year's DevDays in Amsterdam. I don't actually know. Are there any closing announcements that I should be saying? I don't believe so. I hope you all enjoy the rest of DevDays. Cheers.